Thank you everyone for coming this afternoon for this press conference about a very serious situation that the city of Chicago is facing. I'd like to introduce Mayor Anthony Copeland.
At this time, we're here to execute Executive Order 2004. Let me just simply start off by saying good afternoon. Today, we are facing an enemy that we cannot see, feel, or hear. It has the ability to induce fear, panic, and finger pointing. As I look to my left and I look to my right, I am humbled because it also has the ability to unite us. This pandemic will be managed at the state, federal, and local levels, but it will take the community level to beat this pandemic. Know your risk and be vigilant. Look out for the elderly. Remind children to wash their hands and also practice social distancing. Facts save lives. Who should we listen to? Listen to the fundamental facts and the data from the CDC, state health agencies, and your local health authorities. Today, I am announcing the closing of all recreation centers, the closing of the School of Performing Arts. The greenhouse will also be closed. There will be no audiences at public meetings. Meetings will be televised on Channel 21. The water department will take drive-through payments only. Janitorial staff will be doubled at the health department. The city will pause on the rental of any venue spaces. We will limit access to all public buildings, and as a precautionary measure, the state of the city address is canceled. Ameristar Casino is also closing. I also have some recommendations. All restaurants with drive-thrus shall use them to serve their customers and close their indoor lobby service. Restaurants with no drive-thru shall consider delivery or takeout service. Banks should close their lobbies and rely on their drive-thru and their ATM machines. Our buses will continue to run. And every day, every 30 days, we will reevaluate this situation. At this time, I will turn it over to our Health Director, Dr. Brown.
Good evening, good afternoon. I'm Dr. Gerri Browning. I'm the health officer for the city of East Chicago. We've been thrust into this global pandemic of coronavirus and its related infections. This coronavirus is a type of virus that typically can cause the common cold. However, it has varying severities and in its worst form causes severe respiratory disease and risks the possibility of death. We have a number of people that are high risk for contracting this unseen enemy. In particular, the people who are 60 and over and who have chronic diseases such as hypertension, heart disease, diabetes, chronic obstructive pulmonary disease, and of course any type of cancer are at risk. Any disease that lowers your immune system also makes you more at risk for having complications from a potential coronavirus infection. In this city, we have embarked upon an attitude of personal restraint. Up until this point, there have been no diagnosed cases in the county of Lake. In the United States, there are well over 3,000 cases, 68 deaths. However, in Indiana, as of today, there are 24 positive cases, 1 death, I believe, in Marion County, and a total of 139 individuals have been tested for this coronavirus. At this time, our state health department is leading the charge in terms of screening individuals for coronavirus infection. As a rule of thumb, any individual who is referred to the state either by a private physician or a local health department or a hospital can be screened if they are symptomatic. By symptomatic, I mean featuring the main symptoms of cough, fever, and difficulty breathing. In addition to that, healthcare providers are taking a priority. Obviously, if healthcare providers become ill, then we would not be available to take care of the citizens of any community for that matter. What we're doing in the city is embarking upon an all-out effort to socially isolate ourselves and not have less than 6 foot closeness if we can help it. But for the most part in our workstations and workplaces as well as in our homes, we're recommending that all families and individuals sanitize, clean. This coronavirus is a virus that has in its cell membrane a lipid or fat cell, barrier. And that makes it very susceptible to just plain soap and water. You don't need anything, any special disinfectant. It can be well dealt with soap and water. Therefore, we're recommending that all citizens wash their hands frequently. In the event that you can't wash your hands for at least 20 seconds each time, use hand sanitizer with at least 60% alcohol content, and that of course will be vericidal to this coronavirus. In addition to that, we're asking that we use all restraints in terms of socialization and self-isolation. Stay at home, in other words. If you don't have to go, don't. This is a time where we've never been challenged in my lifetime with this type of a health risk, and I think that we are in a very good position here in the city of East Chicago. We have no known cases. There are no suspected cases, no symptomatic individuals. We have in our community St. Catherine Hospital, which has been a part of our community for many years. They are not currently doing outpatient screening for coronavirus. However, if a patient is admitted to the hospital and has suspicion of being infected, they can be tested. And as of this past Friday, there were no diagnosed patients at St. Catherine Hospital with this coronavirus. So citizens, I believe that we're in a good position to stay proactive. We have to be vigilant with our hand washing, hand sanitizing, covering our coughs and sneezes with tissue, properly disposing of the tissue, and cleaning our homes and workspaces and our cars, and don't forget your cell phones. With that, I'd like to just say that if you have any symptoms, the ones I mentioned earlier, or if you're not certain, you can call your private physicians. You feel free to call the health department here in the city of East Chicago. As well, the Indiana State Health Department has a 24-hour toll-free hotline, and that number is 877-826-0011. And that number will connect you with individuals who can do a proper consultation in terms of ferreting out your symptoms, whether you've been exposed to someone as a close contact, or whether you've traveled to an endemic area where the infection might be. So again, I just urge every citizen to be vigilant in your personal cleanliness and sanitization. And I think we can beat this thing. We just have to stay ahead of it.
And also, Doctor, at this time, to my left and right, I have the superintendent of schools. She can share with you what we're doing with the children.
Well, we closed schools down on Friday and today, and until the end of this break, we're going to provide breakfast and lunch for all kids. We're going to serve breakfast and lunch at Locke, Central, Lincoln, McKinley, and Harrison. So each day from 8 to 9, our students are allowed to pick up a grab-and-go breakfast. They're also allowed to pick up a grab-and-go lunch. So we're going to make sure that our kids are fed. We're also in the midst of working with the Boys and Girls Club, some of the neighborhood churches. So we want to make sure that our kids are safe and they are fed. Also, the state of Indiana gave us 20 waiver days. That means that we have 4 weeks to be out of school, and we don't have to make up those days. Those days will be non-exempt. However, we're not going to use all 20 days at this time. We're going to use approximately half of our days as e-learning days. And e-learning is our online curriculum. Students log into a computer. Each teacher makes sure they upload an assignment. The teacher grades that assignment. The teacher has access to the computers. The students can email the teacher. Parents can email the teacher. So even on those e-learning days, even though the students will not be in school, they have access to an educator. In high school, they have access to all their educators. And in the elementary schools, they have access to their primary teacher. All building administrators will remain in the buildings until Wednesday. In the event that we have parents that need to have some questions answered, they can call up to the schools, and the building administrators will answer those questions. Lastly, those non-instructional days, those waiver days, those days were given to lessen the impact of kids going to the library. Because what we don't want all the kids to congregate at the library. So we have this week 3 e-learning days and 2 waiver days. Next week we have 3 waiver days and 2 e-learning days. And I encourage all the teachers to make sure that they give the students a grace period to complete those assignments. Because once again, we do not want all the kids congregating at the library. We want them to be safe in their homes, but at the same time, we want to make sure that they complete those assignments. So we know that this is a work in progress, and we're going to constantly keep our parents and the community informed through our school website, and we will also make sure that we're going to email the teachers to keep them informed. So as of right now, school is closed from May 16th until April 10th. March 16th until April 10th. Sorry.
At this time, Housing Director, Mrs. Tia Carley, if you could just share with us some of the preventive things you've put in place for the seniors.
Thank you, Mayor. I've put those things in place because that's what you requested. One of the things we've decided to work on is to prolong the evictions. I've had a couple of council people contact us, and we're going to allow the evictions to move back for at least 60 days unless there is an emergency to proceed. Also, the 2 senior buildings that Housing Authority is responsible for is the James Hunter and John B. Nicosia. What we're doing is having people hired as of today, and they'll start sanitizing and constantly wiping down, trying to keep the residents safe as possible. Also, we've worked on ordering supplies where they'll have things in the hallways where they can go in and sanitize. The community areas will remain open, but we will also constantly wipe that down to make sure that the residents, because it is the residents are over 50 years of age, and since they're saying about the virus being at least for 60 years and older, We want to make sure that we can protect our residents and keep them safe as possible. We've not had any situations thus far with the residents, but until at least the next 60 to 90 days, we will be proactive to make sure that this continues. The mayor called me, Friday, and said, you need to make sure you have a plan. Considering what the governor is working on, that's what I came up with, me and the rest of the staff. So we worked very hard to make sure that all of our residents will be protected. And not only our senior buildings, we are stepping it up a notch. And our buildings that's over 2 units, which we have a couple, Columbus Drive, they'll constantly be wiping down besides what the regular duties are so far.
And at this time, I can remember when the crisis first started, they were setting the limits of crowd sizes. They said 500, then they went to 250, then they went to 150. Then I just did the executive order earlier today, and I put it down as the 50. Now I just got breaking news. The president just said no congregating with crowds of 10 people. So as you can see, this thing is constantly in flux, I can just tell everybody that if we are all in one accord, we're going to get through this. We are the United States of America. It's the United States of America. We're going to look out for each other. We're going to get past this crisis. It's not a one person walking around here to know everything. Collectively, it's going to be the little bit each one of us bring that's going to get us through this crisis. But I would like the chief, police, and fire to say what they're doing to keep their men safe from harm.
Thank you, Mayor.
Men and women, sorry about that.
Thank you, Mayor. The East Chicago Fire Department, as has been said, we're working together. We're getting our information from the CDC, from the Indiana State Department of Health, and also from our hospital that has protocols over our non-BLS transport EMTs. Non-transport BLS EMTs. What I can tell you at this time is that I can't tell you enough how our firefighters, our police officers are on the front line, just like healthcare workers are on the front line, and we're doing everything that we can, everything that we are being advised to, the guidelines that we are given to protect our firefighters. Here in the city of East Chicago, the ambulance transport is provided by Superior Ambulance, and that is who is here with us, Mr. Jeff Collins. If I can turn it over to you to explain some of the things that we're asking residents and who are calling 911, and when you show up and we show up to assist, some of the things that we're doing to protect firefighters, EMTs, paramedics, and the community.
And not only that, Chief, I want to add before, again, I want to thank Superior for all what they do in helping us protect our community. The city of East Chicago, we not only have 1 ambulance, we not only have 2 ambulances, we have 3 ambulances. Thanks to our relationship with Superior Ambulance.
Thank you, Mayor. Thank you, Chief. So what we're doing for the citizens when they call 911, anything that's high acuity for us would be a respiratory or any type of medical. So what we're doing is what's called, it's a CDC recommendation, it's called the 6-foot assessment. So if our guys get called for a respiratory distress, they're going to either walk to the house or maybe hopefully just get to the door, and they're going to take a 6-foot assessment. They're going to ask questions. Do you have a fever? Have you been coughing? So they're going to try to get that assessment, and then they're going to look for some key questions. Have you been traveling outside the country? Have you been in contact with somebody who has COVID-19 or may potentially have COVID-19? If those questions are yes, then our paramedics are going to go back to their ambulance. They're going to put on a special face mask, and then they're going to bring one to the patient. We're going to come in, we're going to do the assessment on the resident, and if they're not in acute distress, we are going to call the Indiana Department of Public Health. We're going to consult with the Indiana Department of Public Health to decide whether transport to the hospital is actually required or not. And the resident at that time is more than welcome to talk to the Department of Public Health on the same call that we're on. If the resident is sick, we're going to the hospital. We're going to alert the hospital ahead of time. The hospital has a set of protocols set up. We'll take them to the hospital. We'll meet us outside, and we'll take the resident and the patient into a specialized room for treatment. If transport is not required, we're going to urge people to call their physician, stay in contact with the Department of Public Health, and work through getting some testing done that way. So don't want anybody to be alarmed when you think the paramedics are taking that 6-foot assessment. They're doing it for their safety and for everybody else's safety as well. And if those questions are all negative and there doesn't have any indication of a COVID-19 type of illness, then they're going to treat and transport to the hospital just like they do every day of the year. So again, any respiratory or any unknown medical, we're going to have a heightened alert on when we're coming into those homes.
Also, Chief, if you would like to finish this up.
Thank you, Mayor. For our end on the police department, we implemented telephone reporting basically, so officers don't have to go into your house to take the basic reports as far as lost wallet, stolen license plate, stuff like that. You can phone into dispatch. They'll relay that information to one of our officers, and the officer will shortly call you back and take that report for you. And we also stepped up the cleaning in our detention area. Heaven forbid you do get locked up in our jail. We're taking all the proper precautions to make sure that the jail cells are clean prior to you coming in and after you exit the jail.
Okay. And again, I said when you look to the left, look to the right of me. It's that old adage: there's no I in team, and collectively, it's going to take all of us to reassure the public. I tell everybody that chaos it brings. You can't stabilize anything if you're in chaos. It's just too disruptive. But if you panic, it's okay if everybody's going in the same direction, okay? So we just tell everybody, and the one thing that I've noticed, they try to tell people restrain from hoarding stuff. Just, the president, he read a long list of retailers and everything that's there to assist to make sure the shelves stay full. Each day to go past, you see this will get better. But until then, everybody should just stay on guard and be vigilant. That's what I would like to say. Anybody else in closing? Anybody else?
I would, Mayor, just for information's sake, go to the City of East Chicago website, eastchicago.com. There is a link there that will connect you directly to the Health Department's website. The Health Department updates every day because things change every day. Go to the Health Department's website, but you can get there with eastchicago.com, eastchicago.com, and click on the link for the Health Department's website for the latest information.
And again, at this time, I'd like to thank each and every one of you for coming out. And every 30 days, we will reevaluate this and give you an update on what's going on in the city of East Chicago. But again, collectively, we can get through this.
I just want to add, Mayor, you mentioned earlier today that in addition to the 2 senior buildings that Tia spoke on, that you did reach out to the 3rd senior building, even though it's not, so I didn't know if anyone wanted to speak on that they are also being diligent, that the 3rd senior building is not being overlooked, that they have put some protocols in place to protect their
and in essence, they're mimicking the same thing that Tia is doing. Doctor can't say it enough. Wash your hands, wash down the surfaces. Doctor shared with me one time, he said he's been a doctor all these years, and he said when he go from one patient to the next patient, he simply washes his hands. He said that old school stuff is what they call it, huh? Soap and water goes a long way. Any other questions to the audience? This one here.
So now, this 2-week or 3-week period that everybody's shutting down, so is it an assessment period, and that at the end of it you're going to see some kind of data? Is that what we can expect?
I believe when they start doing nationwide testing everywhere and the data start coming in, then we truly going to know how widespread this infection is. Right now, when we did the testing, we just don't have data. And you're really getting the data in real time. If someone gets sick, then they report this person was in the hospital, we interpret, we gave this test. But when they do full all-out testing and the numbers start coming in, you're going to see, I think you're going to see this thing elevate itself. And then and only then are we going to see where we are as a nation and what we're really dealing with.
So I think it's going to be continual reassessment because we really just don't know where we are, whether this thing is behind us or still in front of us. We don't know really where we are. I can't emphasize enough that statistically, at least for the people who've been tested, for people who presented themselves to our local hospital ill enough to be admitted, there is no one that has been diagnosed with coronavirus in our county. That's a good thing. And so I think that if we're diligent with our hand washing, if you're sick, stay in your home. If your illness progresses, contact your physician, call ahead. We can't emphasize that enough. I think that, again, as Mayor says, when we're able to test, and that's a very slow rollout, I honestly don't have a foolproof answer as to when you could get a test. If you're symptomatic, we can push through with the state and get you tested, But other than that, most of us have to be preventive. And so this is our opportunity to show how good we are at doing self and community prevention.
And don't lose sight that this virus does not respect borders. Okay? Now, we border some areas that have positive indicators for this virus, and they've already said they have patients with the virus. And as you know, some of these areas we have very close relationships with because families have crossed the borders. So again, Doctor, I would just tell everybody, just be vigilant. Just be vigilant. And again, just the basic ABCs. Wash your hands, sterilize the hard surfaces, keep the distance, and just the ABC of it.
Well said.
Okay.
Thank you.
Anyone else?
Thank you.
Any other questions? Oh, one other. No, I got one other. Because our buses will still be running. Let's just close with this because our buses in constant state of moving all across the city, and we will close with the director, Frank Rosario, telling us about how they sterilize the buses and what they do for preventive hygiene in the buses.
Okay, since March the 5th, that we have enhanced our daily cleaning and sanitizing by adding an additional step of sanitizing with spraying down all the railings and seat handles. We've also given each bus driver an additional can of disinfectant so that throughout the day they can spray the handles and the railings of the bus, and if there's no passengers inside, then they can spray the entire interior. And then each bus driver was given their own little personal hand sanitizer and told to do their hands as often as possible. Also, as of this morning, we will be awaiting the delivery of some sanitary stations that we will be installing on the buses for the passengers.
Mm-hmm. And also we have 4 brand new buses, and these buses were designed so that they can be easily washed down and sterilized. So yes. We've had that blessing. We just put these online, so they couldn't have come at a better time. But again, I would like to thank each and every one of you for coming here today. Thank you.
Thank you.